Great, welcome Sylvie.
Hi.
We're almost ready to start. We have a large number of people who've joined on the Zoom, and we have a number of others who are watching live on YouTube as well. So welcome to everybody. My name is Sarah Hess, and I work in the Health Emergencies Program at WHO in the EPI-WIN team. And throughout the pandemic since last year, we've been hosting webinars. And I'm sure many of you joined our webinars last year. And so very happy to see you here again. And for those who we've not met virtually before, it is a big welcome to you. And so this year, as we move forward with our webinar series, we really want to try and make these webinars responsive to the questions that are coming from the different communities that we are engaging in. And so what we'd really like to invite folks on the call to do is, if you belong to an organization or are just an individual, or you in amongst your colleagues have decided that there is a certain topics and questions that you have with regards to the COVID pandemic and any of the technical areas within it, please do feel free to send through your suggestions and questions to us, and we will consolidate these into webinars in response to these questions. And so without any further ado, I'd like to just iterate 2 points. We hope to have some questions, time for Q&A at the end. So please feel free to put your questions into the Q&A function on the Zoom rather than the chat. The chat is great to see where everybody's joining from and to meet people, but if you put your question in the chat, we might miss it. So please use the Q&A function. And then the second thing is that we have interpretation happening. So if you require listening, we prefer to listen in French, you should be able to find that option on your Zoom as well. So I'd now like to introduce you to Dr. Sylvie Briand, who is the Director of the Global Infectious Hazards Preparedness Department within the Health Emergencies Program at WHO. And Sylvie, I'm going to hand to you now, and I will share my screen with the presentation.
Thank you very much, Sarah. And indeed, I think the message we want to give you for starting this new year is really that going forward, we would like to co-develop those webinars with you, where you send us the question, the things that you really want to have more information on, and we will prepare the slide set according to your concerns and your interests. So, and I hope it will meet your expectation and answer your question also. So maybe Sarah, if you manage to share the screen. Thank you very much. So, and also to remind you that we have on our website the EPI-WIN updates, where you can find most of those slides already posted. So don't hesitate to go there and to give us feedback as well. We are happy to update the materials and improve them as you see fit. Next, please. So today we were talking about the variant, but before that, I will just give you an update on the global situation. At WHO, at least we have 1 million cases across the world, with certain countries more affected than others. Of course, this is a number of cases, so it doesn't account for the ratio or the proportion of the population that has been affected in those countries. These are mostly very large countries. And regarding the deaths, we have now more than 2.2 million deaths. Also, some countries have more number of deaths than others, but again, this has to be compared to the density of population as well. Next, please. This slide shows you where we have the cases. So it's distributed according to WHO regions. And you see that we have currently a lot of yellow, which is regions of the Americas, also green, which is the European region, and much less in Africa, Western Pacific, Eastern Mediterranean region, and Southeast Asia. And so you can find those data on our website as well. We have a dashboard, but this is a snapshot of the current situation in the world. Next, please. This shows you the hotspots, I would say, of transmission currently, and shows the countries where we have the highest number of cases per million population reported in the last 7 days. And so you see that we have cases mostly in the northern hemisphere, because this is where we have the cold season, and usually people, when it's cold, they stay more inside, and we have more opportunity to transmit the disease. But in those places, for instance, we have now a lot of transmission in Portugal. We used to have more in Central Europe recently, but now it's also it's decreasing. And we have, of course, still a lot of transmission in the US. But you have also transmission in the southern hemisphere, and mostly the region that are also at the bottom. So, and you have a lot in South America and South Africa, although it's declining there as well. Next, please. This map shows the number of deaths per million population, and in the last 7 days. So as you know, because of the incubation period of COVID-19, usually the number of deaths is coming at least 2 weeks, but sometimes more weeks after a peak in transmission. And so the places where you see currently a high number of deaths are not necessarily the places showing a lot of transmission currently, because of this delay between cases and deaths. But countries that have more deaths usually are also countries with more elderly population, because as you know, elderly people are more at risk to have a severe disease, severe COVID-19 disease. Next, please. So let's come to the variants. And I'm sure you have heard about those variants a lot in the media. And maybe you have specific question, but let's try to address at least the most common question on the variant. First, are those variants very unusual? No. All viruses evolve, and this one, SARS-CoV-2, is evolving. And so emergence of variant is expected. And we have seen some of them in the recent past, but we will have more in the future. So we shouldn't be scared, every time we have a new variant, because it will happen again and again. And the variant is because the genome of the virus is changing slightly. And the genome, if I may use this comparison of the variant, is like if you want to make a cake and you need a recipe. So the RNA of the virus, which is at the center of the virus, is the recipe. It's coding, it's a code, it's information. And sometimes there are slight changes in this code, and those changing in the code can have impact on the structure of the virus or the functions of the viruses. And so sometimes the changes don't make much difference in the structure or the function, and sometimes there is the small changes in the genome of the virus makes huge change in the function or the structure of the virus. And so that's why the current variants are studied and monitored, because we want to know if the change in the genome makes a huge difference on the structure of the virus or on the functions of the virus, meaning, is it more transmissible, or is it more virulent, or does it have an impact on vaccines or therapeutics because of this? Some variants are more concerning, and we call them variant of concern, because we have seen that those variants, because they affect specific places in the genome, they can lead to changes in the structure of the virus and also on the function. And a specific change, for instance, is a change in what we call the spike protein. The spike protein is the one you see on the slide that is on the surface of the virus. And this protein is useful for the virus to attach the human cells. And you know, this is the first phase of the infection of the cell, when the virus attaches itself to the cell, and then it can go into the cell to start its reproduction cycle. And so this protein is particularly important. And we have developed a number of medical countermeasures based on the structure of the spike protein. So if the spike protein change, then we may have to revisit and review all the tools we have developed targeting this particular protein. So what we know as well on those mutations, although it's natural and expected, we know that the frequency of those mutations can increase with the number of infections. And I will talk more about it later in future slides. But what we know as well is this virus seems to change less than other RNA viruses we know. And for instance, influenza viruses, they are changing much more rapidly than these viruses because they have a different mechanism of change. And so that's why SARS-CoV-2, even if we have seen some change, it has remained relatively stable since the beginning of this pandemic. Next, please. So what have we observed since few weeks is that some variants that have emerged are of concern because they have change in those important proteins, the spike protein in particular. We have seen, for instance, in Denmark, a new variant, and I will talk about it, related to a jump in species, in the species barrier between mink and human. And so the new variant that emerged was of concern because really showed significant changes in the capsule protein. Then we had this United Kingdom variant called the UK variant, and has been very famous in all the media. The South African variant also in December 2020. And we have more recently a variant called Brazilian variant, and I will talk more about it later. And the importance of those variants is that they have many changes in their genome, but they do have specific changes in the gene coding for the spike protein. So that's why we are concerned about those variants. Next, please. So then you will see in the media or in different publications a number of things that may be not very clear. Is the difference between mutation, variant, strain. So I will try to explain a little bit more what those words mean in general. So the mutation, as I said, is a change in the genomic sequence, the RNA that is coding for the protein that structured the virus. And so, as I said earlier, the spike protein region is particularly important because this is the first phase of the infection of the human cells by the SARS-CoV-2 virus. Of course, there are other proteins that are also important when the virus has penetrated the cell, but those proteins are not so important for certain vaccines or for certain diagnostics. So that's why we pay less attention to those other changes, but we are still looking at them and being very cautious with those other changes. And sometimes you will see a lot of numbers about those mutations. So just trying to explain you what it means. For example, you may have seen the D614G. So it means that the amino acid in the genome at the position 604 of the spike protein has been changed. There has been changed. So, and some acid called aspartic acid D has been replaced by glycine. And so this is the way we express the change in the code of the in the genome. So those variants, what they are the same family of virus, is the SARS-CoV-2, is the same virus basically, but those variants are slightly different. So it's a little bit like in the same family, you have the brothers and the sisters. I mean, they are still brothers and sisters, but they may not look like the same. And so it's exactly the same with viruses. Let's say that the variants are from the same family, but are brothers and sisters. And the strain is more the word we use for variant that shows that there is not only changes in their genome, but also they have a very different structure of change in the function. And so this is what we call antigenicity. And this antigenicity may have a different also impact on transmissibility or virulence. Next, please. So what are the drivers of emergence of new variants? So the first driver is the selective pressure for antibodies. You know, the virus infect a human being, a body, or an animal as well, and this human being will start activating his immune system, so the defense against the virus, and will produce antibodies. And so the viruses, when they see the antibodies and they know that the antibodies will kill them, and so they try to escape by changing their form or their appearance so that they can escape the defense of the human body. And so this is selective pressure forces the viruses to change so that they can escape our immune system. But there are other ways also to select variants, because you will see that sometimes a mutation occurs just it's a mistake when the virus is replicating in the cell. This multiplication or replication is not done well, and there is a mistake, and this is the mutation in the genome. And so you can have in the nature different viruses that are slightly different, but they are alone basically. But sometimes this virus who is alone can also multiply itself and become really a variant of concern with a significant impact on the population, because it started to spread through a special event or during very favorable condition. For instance, if this virus emerged at a time where you have a big crowd attending, for instance, a sport event or religious event, and you have many people gathering at the same time in the same place, and suddenly this virus, who is slightly different, have a big opportunity to spread between a large number of individuals, and then can start its multiplication, but with really a lot of opportunity to multiply very fast. So this is what we call the chance events or founder effect, and this is also at play with the new variants. And so it's always very difficult to understand the proportion of natural selection and chance events that shape the virus evolution. And that's why we need specific studies to try to disentangle the two effects and understand better how a certain variant are spreading more than others. There are other mechanisms, for instance, the species jumping event, which is, for instance, what we have seen with the mink event, where the virus spread from human to mink and then back to mink to human. And every time it was jumping the species barrier, it was changing a little bit. And this is why we ended up with a variant with significant mutations and also a change in its structure and functions. But you have also multiplication of viruses in specific people or patients, for example, immunocompromised hosts, and where we know that usually the viruses stay longer in those people and have more opportunity also to change and evolve. And we have also mutations that are due to the fact that normally there are systems to reduce the number of mistakes or errors when the virus is reproducing itself and duplicating its RNA. But sometimes this function, proofreading function, is not working very well. And so this is why you can have also some more frequent mutation if this function is not fully operational. Next, please. So let's look a little bit what has happened with the mink. You know, in Denmark, you have a lot of mink farms that are raising this beautiful animal. And there was, so SARS-CoV-2 virus was circulating in the Danish population and also in people working in those mink farms. So apparently, SARS-CoV-2 virus jumped from human to mink. There was an epidemic in the mink population, and then the virus jumped back to human, but slightly different variant jumped back to human. And then this variant was called cluster 5 because this particular variant had many mutations in the spike protein and was apparently very transmissible, and also putting at stake the efficacy of vaccine because most of them are based on the spike protein. So in order to stop the epidemic in mink, Denmark killed a huge number of mink during this period, and also tried to contain the spread of the cluster 5 in the area where it had emerged. And so they identified 12 human cases, but after the measures were put in place, this variant disappeared. Next, please. So let's talk about the variant in UK. I think we missed one slide. So the UK variant was appeared in late September, and then we have seen an increase in this variant over time. And the UK authorities were concerned because they put in place quite stringent measures at population level with the ban of mass gathering and some lockdown type of measures. But nevertheless, in spite of those measures that are really effective, they have seen that more transmission than expected. And so they started to try to understand, okay, why do we see this phenomenon? And this is how they discovered that there was a new variant, and that this variant was quite spread in the country. Next, please. But again, as I said, it's always very difficult to disentangle what is due to the virus itself and the way it's mutating and becoming maybe more fit for the human body, and what is due to the fact that the transmission is increasing because people are not necessarily putting in place the measure correctly. Because you all know that we know that, for example, washing hands works very well to prevent the transmission. But sometimes people forget to wash their hands sufficiently. And maybe they wash their hand once a day or twice a day, but not enough to prevent transmission. And so when we say that variants are more transmissible, it's also very important to look at how people are implementing those measures. Because what we know with the new variant is that the measures we are putting in place still work. There is no change in the mode of transmission. But if people are not applying the measure correctly, then you will see an increase in transmission regardless of the variant. And so this is the thing that we are currently studying to make sure that our conclusion on those variants are correct. But what we have seen is that by implementing correctly those measures, you also see the transmission declining. Next, please. So now regarding what we call the UK variant, but it's better to call it the VOC variant, variant of concern, is that now 80 countries have found it. But maybe it exists somewhere else. But some countries, they don't have the capacity to sequence the virus genome, or if they have the capacity, it's a limited capacity, so they cannot sequence all the viruses they have. And so that's why maybe they don't find it. But maybe this variant VOC is much more spread than we know and that we see currently. But this is a map where we have found those variants, and other places it's still under verification, and we are waiting for the latest results. Next, please. So many studies, as I said, are ongoing to try to understand if this variant is more transmissible, how much transmissibility, additional transmissibility is leading by this new VOC. We are also trying to understand if this variant is leading to more severity. And so here you have some studies that have been done and some results. But in a nutshell, this variant seems a little bit more transmissible, and probably it's because it's more adapted to human species. Because as you know, the origin of SARS-CoV-2 is probably an animal origin. Although we are still looking for the intermediary hosts, because we know that we can find this virus in bats, but we don't know from the bat to the human which intermediary host facilitated the transformation of this virus into a virus that is easily transmissible from person to person. But what we know is that usually zoonotic viruses, I mean virus in animals, are not very transmissible to human. And sometimes you have transmission from human to human with those viruses, but usually it's stopped after some time because the virus is not very fit for human population. And so this is why SARS-CoV-2 initially was probably not so fit, but as it evolved, as it tries to escape the antibodies, at the same time, it becomes fitter to human species and also probably more transmissible. But it doesn't seem that this virus is more virulent, meaning that it will not cause more severe disease. But what we have seen in many affected countries is that the virus is producing the same type of disease. And we know that for COVID-19, we will have 80% of the cases with a mild disease and 20% of the cases with a severe or very severe disease requiring hospitalization. So if we have 10 cases, you will have 2 severe cases. But if you have 100 cases, you will have 20 severe cases. And so that's why in certain countries, when the transmission is very high, they also have a lot of people requiring hospitalization and sometimes also intensive care units. And that's why health systems are sometimes overwhelmed and they cannot take care of all those patients. And some of them will die. They could have been saved in other circumstances, but when there is not enough ventilators or not enough nurses and doctors to take care of them, they are more likely to suffer from a severe disease and maybe die if they have severe underlying conditions or are very old people. Next, please. So one question that people are asking very often is, are children more at risk of those variants, and especially the VOC 2020-12/01 variant? Actually, it seems that those variants are spreading same way as the previous variant. But what is important with kids is that we have seen that especially kids under 10 are usually not showing symptoms. So even when they are infected, they don't show symptoms. They are not likely to have a severe disease. And so that's why usually they these infections remain undetected. And for those variants, it seems that it's the same. the kids can be infected, can probably transmit those variants as well. But because most of those kids will not show any symptom and will not complain of anything, these can remain undetected, like for the rest of the variant that have been circulating up to now. Next, please. So in South Africa, we have seen also a variant. And again, it was detected at a time where they have seen also an increase in transmission. But it seemed that this increase was linked also to super spreading event, because it was a time of end of the school year, and there was a number of graduation ceremonies. And after the graduation ceremonies, there was also a number of parties, which is absolutely normal. But then when you have a big gathering like that, and some people may carry the virus, but not necessarily being aware of it, and then it can spread further. And also after the party and the end of the year, school year, students were going back home, and sometimes just facilitating also the geographic spread of this new variant. Next, please. So preliminary analysis shows that both variants, I mean the VOC and the 501Y from South Africa, can spread more easily and infect more people. And again, more studies are done to try to understand better this phenomenon. And as I said, the increase in COVID-19 cases can put pressure on the health system and can lead to an increase in hospitalization and death. But again, the mode of transmission have not changed. And if you continue your preventive measure as you have been doing so far, it's still effective and still reducing the transmission and the risk of severe disease, especially in elderly and people with underlying condition. Next, please. So, as I said, we are studying those variants because those variants can have an impact on the transmissibility, on the disease severity, but also on vaccine, diagnostic, and therapeutics. Because the vaccine, as mentioned before, some of them are targeting, in particular, the spike protein. And so if the spike protein change, the vaccine will elicit the production of antibodies, but those antibodies will not recognize the new virus, or the new variant. Similarly, on diagnostics, we use the PCR, which is a polymerase chain reaction, and this test is detecting the virus and especially the RNA of the virus. But if there are changes, maybe the test cannot be as efficient as it was with the previous variant circulating. So some tests need to be adapted, but most of the tests have many targets. I mean, they are not only targeting one small part of the genome. So usually we can, they are still efficient and they can detect the disease. And then the therapeutics, some therapeutics are broad spectrum. So the variant has no influence. For instance, we use dexamethasone for severe patients, but the change in the variant doesn't affect this therapeutic. But some new treatments, like monoclonal antibodies, are really targeting specific parts of the virus. And so for those therapeutics as well, the variant may have an impact and negative impact, I would say, on the efficacy of the therapeutics. So that's why we are looking at all those parameters and trying to see what is the impact of a new variant on all those things. Next, please. So we have a number of global mechanisms now to monitor those variants. So first, we are sharing information on the genome of the variant, and there is a global database collecting this information so that all the scientists in the world can have access on the latest changes in the variant. There are also multiple studies ongoing in various countries in the world to assess the virus transmissibility, the disease severity, and the efficacy on diagnostic therapeutics and vaccines. And we, as WHO, also organize regularly global conferences, bringing together all the scientists so that they can discuss their results and we can inform the world on what is the current risk assessment. Next, please. We have also set up specific groups to understand how those variants emerge and what are putting pressure on them so that they emerge. And so this is a SARS-CoV-2 virus evolution working group, really making analysis not only on the variants of concern, but on the other variants as well, trying to understand how this happens. And we are also working very closely with countries to strengthen their surveillance system to enable them to carry out the genetic sequence analysis. Some countries, they don't have the machine or they don't have the people to do this. So we are training people as well to help countries to have this capacity. And we also help them to access the information, as I said, through the databases, global databases, and global conferences that we are organizing. Next, please. So, of course, the scientific community is extremely interested in this new phenomenon. And we have also defined a research agenda and the key questions that are really important for us. And so you have those questions on the slide. I don't want to go through them, but obviously I'm trying just to give you an overview without going into details, but there are a huge number of studies ongoing trying to understand this virus. This virus has been accompanying us for 1 year now. It probably will stay with us few more months or years, we don't know yet. And so it's very important to understand what is this virus, what is its dynamic, and what are the interaction between this virus and human population, but as well with animal population, so that we can develop measures to control it much better. Next, please. So I think the key messages are that it's normal that the virus evolve, and as I said, it's not unusual, not unexpected, and so we shouldn't be scared about it. It's more a subject for evaluation and observation and trying to understand what is happening rather than being too concerned. Of course, the increase in transmissibility is worrying because it challenges much more our health systems and measure that we are putting in place. But again, with the normal measure that we know, like personal preventive measure, it works, and we still need to apply them. Of course, it's an evolving situation, and we just have new vaccines available, and we have started to vaccinate people in many countries in the world. So, so far, it seems that the vaccines are working well. But of course, if the virus would change more, we may see that certain vaccine will not be as efficient as we think. So we will have to change the vaccine composition or do something to adapt. So the evolution of the virus really triggers us to look at the situation and adapt our strategies. And this is why it's so important to monitor the virus. The preventive measures are working, so please don't hesitate. Continue to wash your hand, continue to maintain physical distancing as much as you can when you are living in an area with intense transmission. And continue also to ventilate the room where you are so that you can reduce the transmission among yourselves. And also, it's important that people who got COVID-19 are treated and are also isolated so that they don't spread further the virus. But it has to be done in a way that is really taking care of the well-being of the patient and the families, and not isolating people just in a sense of not allowing them to have a social interaction, but just making sure that you reduce the opportunities for the virus to transmit. And then, of course, there are specific communication for certain groups, because we are all together in this pandemic, but certain groups have a low perception of the risk, and they think that nothing will happen to them. And sometimes it's true. I mean, especially young people, they even if they are infected, they won't have a very severe disease, but they can help to protect the others. And so they need to be conscious about their responsibilities in the transmission and help everybody to reduce this transmission. And then there are people who are more vulnerable for getting a severe disease, and those people as well need to be more protected and need to be aware of the risk, especially when there are new variants circulating around. Next, please. So I would like to thank you all for your attention. Also, thank you to people of my team: Judith van Holden, Sarah S., Aisha Tebi, Noeli Nombela, Mark Perkins, Lisa Carter, Maria van Kerkhoff, because to prepare those slides, a lot of people are working behind the scene, checking if it's correct, looking for the reference in the scientific literature, checking if the wording is correct, if it's clear, and also thank you for Tazara's passport for the interpretation in French. I think my message here is just to convey that even if I am presenting, I'm just a team member, and I would like you to be grateful also for the team that is preparing those webinars. Thank you.
Thank you so much, Sylvie, for a really clear and comprehensive presentation. We've got a lot of really interesting questions that have come through. So I think we're going to go straight into the Q&A, and we'll see how many we can get through in the remaining time for the webinar. So the first question really is about immunity. If you've had COVID from one variant, are you likely to be immune to the other variants? What do we know about that? Over to you, Sylvie.
Yes, so yes, you are likely to be immune to other variant, because even if the variant has changed its spike protein, and so will escape to antibodies immunity maybe, but you have other type of immunity, like cellular immunity. And so probably even if it's a variant has changed a bit, it has not necessarily changed enough to really escape your full immune system. But of course, these are things that we are checking because, as you know, we are still there are still some unknown about the human immunity against COVID-19. So, but yes, be reassured.
Thanks very much, Sylvie. Another question from Marine. A lot of countries are closing their borders to slow down the spread of these variants. Is it realistic or even useful? If the variants of concern are already introduced in a country, are they inevitably going to become dominant?
So as I said before, you know, the drivers of the spread of those variants are they are twofold. They are what is linked to the virus itself. The virus evolve. So we will see those variants emerging, and it could be brought by a traveler, or it could just emerge like that as a chance or randomly. But what many countries are trying to do is to reduce the opportunity of super spreading events. And obviously, if you introduce a variant that is more transmissible in a population that is more likely to spread the virus, of course, it's important to put in place measures that will reduce the transmission. Otherwise, the problem is that with SARS-CoV-2 in general, the transmission at the beginning is very slow. You have 1 case, 2 cases, a cluster of cases, but very quickly you have an exponential transmission. So all countries, what they are trying to do is to slow down the transmission as much as possible so that we don't reach this phase where it's exponential, because when it becomes exponential, it's very hard to stop. So everybody has learned since the beginning of the pandemic that it's better to prevent than to react too late. And so everybody tries to put in place the measure early on so that it reduces the transmission early on as well.
Thanks, Sylvie. And do we have any data at the moment on the amount of asymptomatic cases due to the current variants? Most of the focus is on transmissibility, virulence, and severity, but what do we know about asymptomatic cases?
So far, we don't know much about it because, again, these are studies that are ongoing. It's difficult to know the number of asymptomatic cases because, if people don't have symptoms, usually they don't go to the doctor and they don't get a test. So with specific studies on contact, for instance, we have got statistics on the percentage of asymptomatic, or now that travelers are often asked to get a test before traveling, then we have also more information as asymptomatics. Some countries have done population surveys or studies to check for the proportion of asymptomatic. So we had those numbers. So with these new variants, again, we need to check this. But it's complex because, again, to detect a variant is more complicated than to detect the virus, because you need to have a sequence data, and this is a test that takes more time and it's costly. So that's why it's a subject of small studies, but it's not yet a kind of routine testing, and that's why we don't have very strong evidence behind the numbers we have currently.
Thanks, Sylvie. Another question, and this time on transmissibility. When we talk about transmissibility, are we referring only to the capability of the virus to attach to human cells, or does it also mean that this virus is more difficult to destroy, or that it can survive for longer periods of time in the environment?
Okay, so currently you are really right to highlight this, because I think it's a very important point. When we talk about transmissibility, usually as first, indeed, the capacity of the virus to in vitro to infect cells, but it's also the capacity of the virus to go from one person to another person. So usually what we use to assess this is animal studies, because we can control the environment. And then, for instance, for flu, we'll use ferrets to test the transmissibility. And you put ferrets together for a certain time at a certain distance, and you measure if the transmission between the two ferrets is increased or not, depending on the variant. So these animal studies are ongoing as well, but it takes time to get the final answer about this type of transmissibility. What we use now as well, because we do have more tools, is modeling. And so we model certain situation, and then we see, based on the data we see in the reality, if the data we have in the reality are really aligned with what the model has predicted. And so this allows us also to try to understand better the transmissibility. And then we use also some epidemiologic indicators like the R0. I'm sure you have heard about it. And so you can test, for instance, if one person is infected, how many people are infected. And through different studies like that, they have shown, especially in UK, that probably the R naught has increased between 0.4 to 0.7. Um, um, so it means that if you have a R naught below 1, for example 0.8, suddenly it can be a 1.2. And so by those different measures you can assess the transmissibility. But again, as I said before, the problem with transmission in population is that you cannot isolate a population in a laboratory. And so there are always factors that you don't control, like the mobility of people, the physical distance, many other factors that are really hard to control. And therefore, you always wonder, is it because the virus is more transmissible, or is it because people were closer or were more likely to get it? And so we have always, it's always very hard to formally conclude about those kind of things.
Thanks, Sylvie. So Public Health England and SAGE data shows a 36% increase in the CFR, the case fatality ratio, for the UK variant of concern. Do we understand the net mechanism for this increase? Are there any changes in the symptoms?
So again, I mean, I showed the slides about those studies. So people are trying also to understand what is exactly the reason for this apparent increase in severity. But again, there are many factors that can explain a certain, I mean, the case fatality ratio. First is because people are going to hospital later. And or when they arrive to the hospital, there is no space for them, so they cannot be attended. And then they have a more severe disease when they are taken care of, and it's more difficult to save them. You can have also a reason for that is that, and we have seen it in a number of countries, people are not dying from COVID-19, but they have severe underlying factors like cancer. And then they got COVID on top of their cancer, but at the end of the day, it's more the cancer that is killing them than the COVID. But the concomitant of the infection with the cancer may have precipitated the death. So that's why those numbers are very important, because I think it helps us to make better decisions and take better measures. But again, we have to consider them with a lot of precaution and trying to understand really what are the drivers for an increased severity. Is it really the virus, or is it the health system, or is it the behavior of the people, or is it underlying condition, or is it any number of other factors?
Thanks, Sylvie. So one question about the vaccines and the variants. Has what you told us, well, does what you've told us mean that the vaccine that targets the virus's RNA will continue to work against the different COVID variants?
Yeah, so uh, let me explain again what I said maybe at the beginning. You know, so about the recipe of the cake. Um, the RNA, it's like a recipe for the virus cake, and so in the recipe you have the number of eggs you have to put, the number, the amount of sugar you have to put in your cake, and so on and so forth. So um, if the mutation in the genome or the change in the recipe is that instead of 2 eggs, you put 4 eggs, maybe the taste of the cake will not change. But if the change in the recipe is that instead of sugar, you put salt, then the taste of the cake will change a lot. And this is what the change in the genome can, how it can affect the structure and the function of the virus. So certain vaccines are really targeting, mimicking the spike protein so that our immune system can develop antibodies against the spike protein. So if the virus is changing a lot and that its spike protein is completely different, then of course the antibodies that we have produced against the previous spike protein may not work so well. And this is what currently the studies are trying to assess, is how the change of certain amino acid in the genome, what is the impact on the structure of the virus, and especially on the spike protein. So far, the two vaccines that are currently used with using the mRNA techniques, the Pfizer-BioNTech and the Moderna, they have made some studies among vaccinated people, and it seemed that the variant, or the change in the new variant are not affecting the efficacy of the vaccine. The vaccine is still useful and still protect people. Of course, if in the future we have other changes, maybe this situation may change. But for the time being, these two vaccines that are the most focused on the spike protein are still efficient. There are other type of vaccines, and we can talk about it in another webinar, and I can explain to you how much it can impact those vaccines compared to the mRNA vaccines.
Thanks, Sylvie. I think there's definitely an appetite, not just because you mentioned a cake, but because there is a need for more knowledge on the vaccines for us to schedule a vaccine webinar in the coming days. Yes. So I think we've got time for maybe one more question, and there's so many in the Q&A that we've not been able to answer, and I'm really sorry for that, but we will consolidate them and try and feed them into an update of our slide set or something like that, a future webinar. So perhaps for the last question, is there an effort to standardize the naming of the variants? I understand the plan is to move away from country nomenclature, but that is what's easiest for people to understand.
Yeah, absolutely. And yes, so currently, I mean, there are like, I think at least three ways of naming the variants, three types of nomenclature. So it's confusing because then people are not necessarily familiar with one way, or and then there can be misunderstanding. So we are trying to align and have a nomenclature that is easier and allow also scientists to communicate better. But it takes some time, so it's like a new language, so we need to work on it. But from the communication perspective, again, as you have seen on the map I showed, now 80 countries in the world have found the variant, so the VOC variant. So calling it a UK variant first, it's not correct because it's not. It was not born in UK. Probably it's emerged in many places at the same time, and also it stigmatized UK unnecessarily. Same with the Brazilian variant, which was discovered in Japan at the beginning. So I think these locations are useful for us because it's easier to remember, but it's not very nice for the countries that are affected, because at the beginning, for example, you have seen that naming it UK variant then has impacted there have been border closures elsewhere and so on. So that's why we need to move away from this, because the impact on population and stigmatization of certain population or certain location in the world is not good for the people. And it's not reflecting the reality, because they have nothing to do with the emergence of this variant. This variant will emerge whatever we do, and it's nothing to do with the rain, with the sun, with the climate, with the geography. It's nothing to do. It's just the nature of viruses to evolve. You are muted, Sarah. Sarah, you are muted.
Hello?
Yeah, this works now.
I had a strange incoming ringtone going on in my phone, and apologies for that. Thank you so much, Sylvie. So I believe that we're at time, and I
Yeah.
just want to say thank you very much to you for today and for the presentation. To everybody who's listening, the recording will be available on YouTube. You can find it there, and that's where we stream all of our webinars too, so that if it is oversubscribed, you can go directly to YouTube and watch the webinars there. And we will also be able to share the slide set shortly with you if you're interested in that. And we look forward to you joining us for future webinars. And of course, like we said in the beginning, please do send through your recommendations and your wishes to collaborate on some of these webinars going forward. Thanks very much, everybody. And thanks to Zara for the interpretation and to Judith, who's been answering questions in the background.
Yeah.
So have a lovely rest of the day, everybody. Bye-bye.